manager here at Bloom for Women, and welcome to another episode of All Things Bloom. There are an estimated 27.6 million victims of human trafficking globally. Pennsylvania is now 11th in the United States for reported trafficking cases. Lehigh Valley, where we are sitting right now, is a hotspot for human trafficking. And so I just want to give you a quick definition of human trafficking. According to the Trafficking Victims Protection Act, human trafficking is the recruitment, transportation, transfer, harboring, or receipt of a person by means of or the threat of use of fraud, force, or coercion or deception for the purpose of exploitation. Now, we want to warn you that some of the content of this podcast today will be sensitive and graphic. And if you or someone you know is experiencing human trafficking, please call the National Trafficking Hotline at 1-888-373-7888, or you can call our Bloom Outreach Resource Line at 484-268-8581, and someone will assist you. Well, I am so excited. My brothers are here. One of the things that we talk about at Bloom is that we can't do what we do without community partners. And so we have two amazing community partners who I work with closely. They are from street medicine. And so I do want to give them an opportunity to introduce themselves. And I'm excited about these conversations because if boots on the ground is two people, that is these two right here. I'm super excited about the work that we do, that we get to do, and they're just amazing partners. So the funny part is this is Josh and Josh, but this is Josh and JJ. So I'm going to let Josh introduce himself. Just share with us who you are and kind of what your role is in Rich Street Medicine.
Sure. My name is Joshua Newland. I'm the certified recovery specialist with Valley Health Partners Street Medicine. And my role is just to use my life experience to help our patients hopefully achieve long-term recovery. And specifically, I work closely with JJ to help folks that are on paper have some sort of legal involvement.
Awesome.
Yeah.
Awesome.
Hello, everybody. My name is Josh. You can call me JJ. I am the criminal justice navigator for Valley Health Partners Street Medicine. My role entails of being able to help individuals who are homeless and dealing with legal involvement. So whether they're, again, on probation, they're on parole, if they have active warrants, or if they're getting ready to be released from jail, we help them overcome barriers if they need any medications, things like that. So me and Josh work side by side, so we're partners in crime. No sidekicks. We respect each other,
Yeah.
and we work alongside closely. And the cool thing about it is, although we have these titles, we wear multiple hats on the team, so it's pretty unique the work that we do.
Absolutely, absolutely. What I want to get into, we will talk about trafficking and things like that, but I need for people to understand what you see every day and what is a typical day. And we know that things change randomly, but what does a typical day look like for street medicine? Where are you guys? Where do you go? What do you do? Who do you see?
So a typical day, the cool thing about it is that every day is gonna be different. It's never gonna be the same. So one of the things that I've learned that I've actually took from a street medicine symposium last year, that every day when you walk into your first day of camp, every day you walk into a camp is gonna be your first day. So we go in, meet with anybody out in the woods. We have survival supplies. We have medical supplies. We have our backpacks with us, heavy backpacks, big backpacks, little backpacks, all these different things. And walk into the woods and meet with anyone who potentially might need anything, whether it's water, wipes, medicine, if they have any wounds, different things like that. Long trails, short trails, hot weather, rain, snow, summer day, think of all the treacherous weathers we're out there walking out there Monday through Friday, being able to meet the folks and meet them where they're at. When we understand that their planning horizon is much more different than ours. A lot of times when we go out to see folks, we're meeting them where they're at, and we have to make sure we bring that awareness to different agencies and companies that, like, hey, these individuals who are dealing with barriers of homelessness, they don't, their planning horizon is so much more different. So on our day-to-day, we don't know what we're going to expect. Whether
Yeah.
it's a long day, long day with one patient, whether it's helping them get into rehab, whether it's helping them get into a specialty hospital, or whether it's meeting multiple people and having a successful day,
Yeah.
encountering with folks. So it's so many different
So
things.
many different things. Yeah. What is your thought? Kind of how do you? What's your perspective as a CRS?
Yeah, I would like to add also too that we are primary care, so we are a full working medical team, just like your family doctor, except we're not in a brick and mortar building. We're in the community, and we cover from Northampton County, all of Northampton County down to Lehigh, and we have two PAs, a nurse practitioner, two nurses, community health worker, myself, JJ. We have a behavioral health specialist, an MA. Am I missing anyone, JJ?
The site manager.
Yep. So it's about 12 or 13 of us.
Correct.
And we split up into groups to go out to these encampments.
Yeah.
And I don't know. I've lived it, so like it doesn't seem like it's nothing new per se to me. But I mean, we see everything and anything.
Yeah.
From people that are struggling with substance use, that are struggling with mental health, that just fell on hard times, people that are being abused and trafficked. What else? I mean, you name it, we probably see it.
Probably have seen it, and they're putting it mildly, and they're putting it nice. Not only do they go to encampments, they go to homes, they go to drop-in centers, they go to psychiatric hospitals. They follow up, with clients wherever they are, and we are also the three of us sitting here are people of faith, and we are sitting in a faith-based organization. So, a lot of the times when we're out there, I kind of understand what Jesus did, right? And going to meet people where they were, and being amongst the least of them. So what I know you said you had some lived experience, but what drew you to this work?
So I started off originally working for Lehigh Valley Hospital as a patient service representative. Still undecided on what I wanted to do, and then somehow came across I got a notification about community health worker. So I was reading up on the title. I was like, oh, this is pretty cool. Like, I think I would fit this job. So I applied because of my work. Some of the doctors in the office referred me to Nani, who was the original, well, not the original, but one of the old PA directors for Valley Health Partner Street Medicine. So I was thinking like, yo, when she explained it to me, I was like, I think this is something that I want to do, be able to serve in the community. Like you said, somebody of faith, like, I'm already in my church, I serve in my church, and whenever we go out and do outreaches, we see people meet them where they're at.
Yeah.
So I'm like, being able to do this while working, like doing it, it's like, yeah, exactly. It's a double blessing right there.
Yeah.
So when Nani explained it, she was like, hey, so at the moment, our community health worker position was backfilled, but we never had a PSR, which is a patient service representative, on street medicine before.
Yeah.
So we can be able to create a position and we can bring you on.
Yeah.
And then I came out on rounds, just to observe, see if I'm really about it, see if I really like it. And when I tell you, I fell in love with it.
Yeah.
I was like, this is where I want to be able to help the people and be the light. And honestly, like as a kid growing up, I've always wanted to, find a way to work with kids.
Okay.
When I found out how much schooling was going to be needed for it to become a pediatrician, I said, nah, I got to find another way to reroute. So then I went to school for criminal justice and was like, all right, I can find a way to make an impact on the youth. But I feel now, in this moment of my season in my life, I feel like God is, has me placed where I am right now to work with folks who are, the population of homelessness that are going, that are older, not the youth, but hey, I can still be able to make an impact on their lives.
Absolutely.
It's never too late. Just because you're older doesn't mean like, you can't change your life. So then as I was a PSR on the team, I just fell in love with it, and I just continued to keep we're working through it, and it's been amazing.
You know what? It's a phrase he said. Did you want to say something, Josh?
No.
Okay. It's this phrase that he said. And I think for this work of outreach, now we're going to start shifting into the nitty gritty of some things, okay? Because what we're not going to do is sit here. The thing about this podcast is real talk, okay? Right. About trafficking and real talk about other things. And what you said was so amazing. I needed to see if I was about that life. I needed to see if I was about that life, because outreach is not for the faint of heart. It's not for the weak, and it's not even for those who say, I want to put on a cape and run in to save people, but it's literally about seeing and meeting people where they're at. And so encampments are not pretty. They don't look good. They don't smell good. But this is where people have had to find and try to build something for themselves. And so, what would you say, Josh, are some of the needed qualifications for a person to actually do outreach? Real outreach, not brick and mortar. Because see, people think, oh, I fed, that was enough, and I gave somebody clothes, and that was
Right.
enough. But there's such a bigger picture when it comes to outreach. So, what would you say?
Um, I would say you need to be able to just roll with the punches. You need to not have a weak stomach. You need to have boundaries. You need to really protect yourself and protect your teammates. Like,
Yeah,
meaning make sure everybody's doing their self care and getting rest. Because uh, if I'm not feeling okay, then
yeah,
I'm probably not going to give the patient good
yeah.
care. And then my team needs to know that so they
Mhm.
can kind of pick up the slack
Yeah,
for me that day.
yeah,
You know?
yeah. And we actually do check in
Yep.
before we go into the encampment. We literally stand in a circle and we do a check in. And
Yeah.
it's like, what letter are you today? And so it's A, B, C, or D. And if
Right.
wherever we are, we get to explain maybe why we're feeling that way. And then, someone will say, well, we'll watch out, watch out for you, that
Yep.
day or whatever the case may be. And that's important because one of the things that we'll kind of shift into um outside of what it looks like, there's so many different things happening. So we are an organization, we partner due to the trafficking piece of it. So it's dangers that are seen and unseen, right? Known and unknown, that you're literally walking into when you go into these encampments. And so number one, there's this element of trust um with relationships in those encampments, so nothing happens to you while you're in there. And then there's this thought for just running in. So I guess my question is the uptick in trafficking. I remember having a conversation with you. I don't know. It might have been last year, and you said something about being in school and surviving some things yourself, but also just having a like seeing trafficking in the encampment. So can you guys talk to me a little bit about that? What are you seeing in the encampments as far as trafficking goes?
Well, fortunately, when I came and joined street medicine, our director at the time was Nani Pedrado, and she's with Heal and does a lot of this work. So uh, I think we all got like trained in what to look for and what to expect like immediately.
Okay.
We do that stuff really well. As far as what we see, I mean, we see anyone that is experiencing homelessness or doesn't have a doctor. So
Mhm.
that sometimes is like the abuser or the trafficker, or sometimes it's the victim. Sometimes like nobody's even aware that like what's happening is trafficking.
Yeah.
Um, but there's a lot of foot traffic, and what we're seeing more recently is that the homelessness is on the rise,
Yeah.
and the encampments are increasing by like the dozens as
Mhm.
days go,
Yeah.
and it's really drawing a lot of attention. And encampments that we used to know every single face, we're walking in and not knowing anyone.
Mm.
Um, and there are a lot more occasions, I think, when we're seeing new patients that are opening up to us and sharing what they're experiencing.
Yeah. Yeah. Yeah.
But I think being from Philly and from the street, I kind of like get a sixth sense about certain stuff,
Yeah.
like
Yeah.
intuition type deal.
Yeah.
But JJ too. JJ grew up in Allentown, Second Street. So that the camp I'm thinking of is like right near there.
Yeah. Yeah.
Um, so we also have a lot of folks in the community that like report back to us
Yeah.
when we're not there.
Right, to tell you what's
Yeah,
going on.
yeah.
Yeah.
So
Yeah.
and trust. It's mainly trust.
Yeah. Yeah.
Yeah,
What would you say?
that's so true. Definitely on the naughty part. Like, I think when we first started, when I first started going on rounds with Nani, and we started suspecting certain things of trafficking, like she kind of already had it like a plan built out, guideline on like who's to call. She built
Yeah.
all the connects and everything
Yeah.
to make everything happen. So that like kind of when she left is like, all right, we already know, and then we continued with the trainings and just
Yeah.
continue to be more aware of all the new different things that are developing because
Mhm.
as we know, with technology, everything's advancing.
Yeah, it is.
Everything
it
is
is,
advancing.
it
So
is.
it's like this. It's like, the traffickers are trying to develop a different skill set on how they can be able to avoid and be away from the from the public's
Public
eye.
eye. Yeah.
So, especially, yeah, and like Josh said, being from the area, the streets, and things like that, being able to just pick up on those P's and Q's. Like there's certain things that you'll see as like, so that seems a little off something,
Yeah.
but how do you want to say like desperately I want to help you to the person without drawing a red flag, or because I'm at the end of the day I'm getting ready to go home after
Yeah.
this,
After that. Yeah.
and then I might have put you in danger kind of
Yeah.
thing. So it's like I got to make sure I know I can come back to you safely and how we could be able to work out a plan to get you out of this danger.
Yeah.
Um, and some people try, to play it smooth, try to pull it off, think they can fool us, but it's like you can't, you can't fool people with experience really, because we see it and it's like, all right, we know what's going on, and then being able to go back to your team and talk with the team, debrief with the team. That I think that's so big. Being able to debrief whenever we come in contact with certain with hard scenarios, and it's like, dang, what could I have done differently? What can we do for next time or for future scenarios? And then especially when it comes to trafficking, we have to be very delicate
Yes.
and know how you want to approach it.
Yeah.
Because if we make it to bring it to the person's attention and that person sees something going on, we could bring danger to ourselves potentially.
Yeah.
So we always want to be cautious, and then we attack.
Yeah, absolutely. And that's where I enjoy the part of what I get to do with these two. And I have worked with the other teams who are very concerned and have that same heart towards making sure that people are safe and making sure that people get what they need. And I just want to say thank you, first of all, for you guys being the eyes and the ears, because that's what allows me to be able to partner with you to go in, you know what I mean, and to begin to handle them. And because the situation is delicate, sometimes we're not able to snatch people out. So a lot of what we do together is building relationship. Having conversations and building trust. And I think I was out with one of the other teams, and there was a lady we met at the tent, and she was like, "I don't want to talk to you all. I don't know you. Don't want to," or whatever the case may be. And by the time the situation ended, I was sitting in her tent, crisscross applesauce, having a conversation with her and getting a list of what she needs. So sometimes outreach is building those bridges and having that continual relationship. It's so funny because she texts me directly. She's like, you can come. So a lot of what we're seeing with those trafficking relationships is that people are also in that life because that's all that they have known. And it's still the stigma that people want this, right? That people innately want to be homeless or they want to be on substance use. And what we see in the encampments is the intersectionality of all of it.
Yes, correct.
We see the intersectionality of substance use, of trafficking, of homelessness, of mental health. Oh God, mental health is such a huge part of what we do there. So sometimes in doing that, once we've identified the trafficking, sometimes it's working through the layers of what's happening. Some days you can go. We went to one encampment where they loved them one day, and another day, as soon as the lady saw us coming in, she was flipping out. But you still have to love and continue to still, to build that relationship. What do you feel like has been useful for the two of you in relationship building with
like
population?
I would. Well, so this is the cool thing too. I'll never forget. I've learned this, and it's always going to stick with me. Whenever we see somebody and they don't want us, we'll come back.
Yeah.
We'll come back, and we call it vulture medicine.
Okay.
So just keep circling back around. Like, hey, you might not want something from me now, but maybe a day later, a week later, you might continue to, or you might want something.
Yeah.
And I think being able to, keep on your word.
Yeah.
Being true to who you are, not making promises you can't keep.
Yeah.
And actually, being attentive and being that listening ear, because sometimes they don't got nobody to talk
That's
to.
true.
And you're the closest thing to to somebody.
Yeah.
And it's kind of crazy as you say it, because I was thinking when we were in the encampment, you're over here, you're standing outside the tent, and then we're cleaning. We were cleaning the camp as well that day. We had the cleanup event. So I'm over here wheelbarrowing back and forth, right? You're standing there. After like the third wheelbarrow, next I'm like, where's Sheniqua? Sheniqua's gone. I'm like, wait, no, Sheniqua's inside. He was inside the tent. So it was like, yo, like that's pretty dope. Like the trust that was built in right
Yeah,
away.
right away.
You
Yeah.
know, and a lot of people could see that too. They could see how determined you are.
Yeah.
If you're somebody who's really like, you know,
Mhm.
that if you really are invested into that person, that you
Yeah.
really care. Um, and our patients are good at that too. They can
Yeah.
read when
They
somebody's being
really
fake.
can. Absolutely, they really really can. I think I'm a licensed social worker, and one of our ethics is respect the client's right to self determination. So it's just because our presence is there does not mean that the person has to respond in the way that we want them to. So I think for me, just respecting where they are and how they want to be, and then even their boundaries. I think sometimes when people do outreach, well, I'm coming in here to do this, so they need to do that. But even respecting people's boundaries, when I go in the tent, is it okay if I sit here? Is it okay if I do this or that? We have gone to places with other teams. Well, I've been able to go with other parts of street medicine where the woman is living in the car with the abuser. So, of course, while someone is examining the abuser, not treating him nasty, not being mean or whatever, it gives me the opportunity to, talk to build a relationship with the survivor. So it's just important. I feel like to have all these different strategies. Now I'm probably gonna trigger word right here. What are the barriers? Sound off, JJ. Sound off, Josh.
The
What are
barrier.
some barriers that are hindering this population of people? What's not there that needs to be there? What's happening that's unfair? What could be different?
I would say we need much more affordable housing. Number
Mm,
one, mental health services, access to medications for mental health and therapy.
mhm,
Um, Animals are a huge barrier in the terms of like our
mm,
patients owning pets
yeah.
because it keeps them from going inside when housing opportunities come up or going to rehab or mental health treatment,
Or ER,
like
yeah.
certain things they will not do because of this pet. So
Yeah.
that's a huge barrier.
Yeah.
um, Transportation is a barrier. uh, and honestly there's really nowhere for people to be anymore. They're
Mm,
kind of corralled into these tight areas and now they're becoming overpopulated. So
yeah.
I think the next concern by some of these cities are going to be safety concerns, and it may get shut down. So
Yeah. Yeah.
And I feel like ever since we started on street medicine, man, as we see the development that's going on in the Lehigh Valley, it's like Josh, myself, and a couple other teammates, we're like predicting what's going to be next.
Yeah.
Oh, this is being built next. This is being built next,
Mhm.
and it's all curbside appeal. You know, let's be honest. Like they
Yeah.
all want curbside appeal,
Yeah. Yeah.
and the city is invested, so they want more apartments, all these buildings, luxury living.
Yeah.
And where's the fairness
Yeah.
for the
The
homelessness or
homeless.
for the low affordable housing?
Yeah.
Uh, but one of the big things that I think that should be taken into the next step to be able to help, build relationships within the community and the legal. I'm
Okay.
thinking like more community outreach officers. Like
Okay.
I understand we have the officers on the bikes, like yeah,
Mm,
school,
no.
but it's like we need them like in the community
In the
centers
community
because not only
center.
would that deter away like the trafficking and like
Mhm.
the substance use.
Yeah.
Who's gonna get high in front of a cop?
That part.
You know what I'm
That
saying?
part. Yeah.
And like maybe they can continue to keep building a relationship, and that might even come to a point like if somebody who's going through something, whether it could be trafficking or they were assaulted or they were robbed or something like that, they have a community officer that they trust
Yeah.
that was developed. Hey, like this was
Mhm.
happening, this was going on at
Yeah.
the camp. So
Yeah.
things that can be avoided
Yeah.
for if somebody new who's going to be newly homeless goes into that encampment, doesn't know what they're going to be walking into,
Yeah.
and it could be all that could be avoided because we will have more community
I love
officers
that.
out there.
I love that, and I love that because the culture that we have now, for many different reasons, there is this breakdown between the community and law enforcement. And I think most people that are being abused, being trafficked, being sexually assaulted, especially in the encampments, will not reach out because there's been a breakdown, in that relationship. And a lot of time we meet community officers and they say that they want to do things, but I think put on some plain clothes.
yeah.
Yeah.
Put some plain clothes on. And let's go out here. Put some plain clothes on and just sit and observe and find out, where your heart is. We live in very difficult times, and the helping profession is not an easy place to be in. But I think when we talk about outreach work, um, have we lost the love for being effective? You know what I mean? Does it become this ritual thing of just doing? This is what we do. This is how we do it. We
Right.
can we can say we can build our numbers and get data, but where's the impact? That's the thing. I find that the approach that we have in working together allows people the space, but we know that we're the first line of defense, but the next line is law enforcement, especially when we're talking about trafficking. And so if those relationships are not built and there's no level of comfortability there, then people will choose
Stay
to
silent.
stay with the evil that they know. Because that's what it is.
Yeah.
When you are kind of in that life, you become acclimated, and so you feel safe in the evil that you know, rather than what you don't know. Let me ask this: um, any big wins? Have you seen? What are some of the big wins? I got one. We got
Yeah.
one.
To see it,
Start to finish.
yeah,
Go
start to
ahead.
finish, a like full, like complete, like, well, I don't want to say 180 or 360. I don't know, full circle.
180, a full
Yeah,
circle,
like
360.
yeah, like a full circle moment, like from the beginning, and we made it to the end.
Mhm.
Like, for like, dang, that's it. Like, like we couldn't do nothing, or we only got them to this point, and that was it. Like, no,
Yeah.
like this is a success story.
Yeah.
This is a testimony.
Yes.
Like for other people, other individuals. Now,
Yeah.
like this person could be able to go make an impact
Yeah.
wherever they're going to be at now for one or two other lives,
Yeah.
and continue to keep spreading. So that that's a win. I think every time we get people into rehab is a win.
It is.
Every time we get people off papers is a win.
Mm-hmm.
When we're going to the courthouses and being there for our patients, just supporting them,
Mm-hmm.
and the judges knowing who we are, like that's
Yeah.
a win.
Yeah.
I'm trying to see what else. When our folks are getting out of jail and they're seeing our doctors right in the back of the jail,
Yeah.
those oh my gosh, like
Yeah.
straight W's right there. So then I always try to tell the team, like, we got W's.
Yeah.
W's,
Yeah.
W's, W's always.
Yeah. What are your thoughts? Any big
No, I
ones?
second all of that. Because I try to stay focused on the small wins, because otherwise I would get burnt out. It's a lot. Um, you know, you can't make anybody do anything, and people are going to do what they want to do. So we just keep showing up. We keep being consistent, supportive, and I do it for the one person.
Yeah,
that
that's
gets it.
it. Come on.
Somebody did it for me.
Yeah, I have two stories I want to share real quick, and I'm going to be mindful of how I share this. But we were in this together. If you didn't catch it, they also serve in the jail. So a lot of the time we're sitting at the table together with people in the jails, just working with them to get them what they need, which is amazing. But a couple of weeks back, we were going to do something for another person in the encampments, and we encountered someone. And it's amazing how people know these two in the community. They didn't flag down a police officer. They came over and walked over. I think it was to you and I, right? And said, "This person needs saving. Could you go over there and see if she's okay?" Now, the situation turned, a little weird because people are fearful and things of that nature. But when you want to talk about follow through, when someone is nasty to you or hurtful to you, but they're scared, and we stuck with this person and had to follow it out to make sure, that they were safe. So that's what boots on the ground looks like. And this all took place in front of the jail. Okay. And all we had was each other. But the big win that we were celebrating prior to the podcast, we have recently they encountered someone and kind of reached out and was like, "Hey, what can we do for this person?" And 60 days ago, brought this person here, and we worked with this person all day. Got the person in the rehab, and she did very well in rehab, and we are about to exit her completely out of her trafficking situation in the next few days. So we celebrate that. We got that information right before coming into this podcast, and that's what it's about. That's what boots on the ground looks like. It's reaching out and reaching in. It's not just the outreach part, but it's reaching into people, and it's saying that I see you and I'm okay with what I see. And more times than not, that is kind of the biggest thing that people just want outside of what they manage to they do. When I saw them do an eye exam, I said, "Oh, this is amazing." They were doing the eye exam. And I'm like, they are doing a whole eye exam right here. Um, um, they're able to get their Suboxone shots. Not Suboxone shots. They're able to get whatever shots it is that is it
Abilify.
the Abilify, the mental health shots. If they're on if they're on mental health meds, just um meeting them everywhere where they are. So for those few moments, they get to feel safe, they get to feel seen, and they get to have, their basic needs met. And one of the things with trafficking, why most people stay in trafficking or even start trafficking, is to have those basic needs met. We're not even going to start talking about mental health and all those, substance use, excuse me, and all those things that come into play. But it's usually like basic needs. So for a person to not have to worry about their basic needs, listen, and to feel safe, if that's the impact that we get to make. But I love what we're doing one by one. I am grateful that you guys actually care about what's happening. We're kind of on a mission. We're not going to expose all our secrets, but we are on a mission to eradicate trafficking because it's happening right here in Allentown, right here in Lehigh County, right here in Freemansburg, right here in Catasauqua. It is everywhere. And these two right here, I get to go with them. But these two, the cases that are underreported, they are encountering them. They are encountering them. So I am honored to be boots on the ground. I look forward to every time we get to go out and every time we get to share and every time we get to do. And I thank God that I'm out there with the team that's and all of them, all of the teams that are on the that work that they are a part of, kind of have the same heart and the same nature. So I am honored that you guys are our community partners, and these are my brothers. These are the, and we're missing one. Our Camille. Last question. Last question. What is the legacy? And I'm asking this to each of you. What is the legacy that you want to leave in this work? I always ask the legacy question at the end. What do you want to be remembered for in this work?
That I served with love, with compassion.
Mhm.
And there's every time I drop my son off at school, I always tell him, when you go to school, I always tell him, I said, go be the light, Bobby.
I love that.
So what I'm telling him,
Mhm.
I want to make sure I'm living by doing as well. So every time I'm going into all these encampments, I want to be the light for everybody because it's a dark world out there.
Absolutely.
Everybody needs love. Everybody needs Jesus.
Mhm.
And I think a lot like the work that we're doing. It's not really necessarily our work. It's God's work. It's God's work.
It is.
So then I think a lot like Jesus was human. He was a man.
Mhm.
He could have easily been vulnerable to giving, to failing, to giving
Yeah.
up,
Yeah.
falling into temptation, all these different things. But there was a source. There was something that he was relying on. There was someone who he was relying on to be able to, overcome all the battles and struggles and trials and tribulations. So, and he served with a purpose. He served as being light in this dark world.
Yeah.
So I think, serve being the light.
Being the light.
I'm always living by that.
I love that.
I think my legacy, I just want my daughters to be proud of me.
Yeah.
That I wasted a lot of my life. So,
But you are, we talked a lot about that as we're going. But I think, it's a scripture in the Bible that says, I will redeem the years that the cankerworm, the palmer worm, and the caterpillar have stolen. And I think sometime, and even me, I myself, and also fallen into some places and situations, looking back on my life like a lot of, but I thank God that we arrived in the time when we needed to be where we needed to be, to do what we needed to do. Because if we didn't have that wasted time, we could not show up the way that we get to show up. Yeah, so we get to be boots on the ground, but sometimes when you can't go, you have to uphold and support the ones that are going. And so, as community partners, that's what we get to do with each other. And so, if you can support any of those things that were requested, please, you can will make sure that the survivors, the homeless, that they get what it is that they need. And so, I thank you guys so much, and thank you for allowing me to tag along.
We love having you.
Yeah.
Thank you for allowing me to tag along. So thank you for tuning in to this episode of All Things Bloom. We will talk to you soon. And I also want to tell you guys happy Father's Day, because that is coming. Happy Father's
Thank
Day,
you
that
so
is
much.
coming. Yeah. So we're gonna go out and have some lunch soon. Thank you for joining us for this episode of All Things Bloom. And we want to remind you, if you or someone you know is experiencing human trafficking, please call the National Trafficking Hotline at 1-888-373-7888, or you can call our outreach resource line at 484-268-8581. Also, if you need to, if you know someone who is homeless, struggling with mental health, please reach out and we will connect them with street medicine, so that they can get the health care that they need. Thank you so much. Have a good
Street medicine, what is the goal? To provide holistic primary health care to people experiencing homelessness on terms that are acceptable to them. The team's success relies on delivering care with compassion and dignity, and collaborative relationships nurtured between the patient and healthcare provider. The values of street medicine is that the model of healthcare can contribute to vastly improving health equality for an entire community, not just the unhoused. And who is eligible for street medicine services? Anyone in the Lehigh Valley experiencing homelessness. So right now, street medicine needs your help. They need tarps, bottle of water, baby wipes, flashlights, battery packs, power packs, bug spray, socks, sunscreen, umbrellas, tents, duct tape, bungee cords, hygiene products, sneakers, new and used, all sizes, and charging cords. If you can help, please email Jonathan CABOT at valleyhealthpartners.org.
Freedom Glow Body Glitter supports survivors of sex trafficking and sexual exploitation in the Lehigh Valley as they recover from their traumatic past and rebuild a life of independence and freedom. Thank you for helping survivors shine.
Come stop in at my sister's closet located at 3650 Nazareth Pike, number 13, Bethlehem, PA 18020. We're having our clothing sale from June 16th through June 21st. 20% off full price clothing, and VIP 25% off full price clothing. Hope to see you soon.